Good evening, everyone. Thank you for joining us for the first in a series of conversations on mental health offered by the Sioux Falls School District with experts from Avera. Tonight, we'll focus on the topic of suicide as September is National Suicide Prevention Awareness Month. According to the American Foundation for Suicide Prevention, suicide is the 12th leading cause of death in the United States. Almost 7 times as many people die by suicide in 2019 than in alcohol-related motor vehicle accidents. Yet many of us avoid talking about this topic of suicide because it's a difficult subject or we're worried about putting the idea into someone's mind. Tonight, we're going to share with you useful advice on how to have the conversation about suicide and why it's important to address this topic directly. At this time, I'd like to introduce Dr. James Nold, Assistant Superintendent, to offer a welcome.
Good evening. On behalf of the Sioux Falls School District, I want to take this time to welcome you to this 9-part presentation that is titled the Family Forum Series. I want to also take the opportunity to thank Avera for their partnership with us in providing this service to our families. You are welcome to join us on this third Tuesday of each month to hear information on a variety of topics that are intended to strengthen and support our families. You will also gain knowledge on resources that exist right here in our community that may provide help for you and or your family. And now I look forward to hearing from our presenter, and please do not hesitate to provide us feedback on the Sioux Falls School District Let's Talk app that can be found on the Sioux Falls School District website. Thank you again. And now back to Ms. Myers to introduce us to this evening's presenter.
Thank you so much, Dr. Nold. We'll now move to the presentation. This session will be recorded and placed on the school district's website if you want to reference the information later. We will not be taking any questions during tonight's session. Tonight's program will be presented by Thomas Otten, Assistant Vice President of Behavioral Health Services at Avera. Thomas has worked in behavioral health for over 25 years and has been instrumental in the behavioral health service line, which brings together behavioral health caregivers across the Avera footprint. Welcome, Thomas, and thank you for doing this presentation.
My pleasure to be here. And I am very pleased to have this partnership with the Sioux Falls School District. I think it's a very forward-thinking school district that looks at kids beyond just what they do academically, but to really help kids succeed in an ever-changing world. What they do outside of the classroom, and particularly in some of the behavioral health areas, is critically important. So we're super excited about this Family Forum series, and tonight's topic is a heavy one, but that's why it makes it so important for us to talk about. I'm going to start with a little bit of background information on slides, just some statistics that will give you an awareness of kind of the situation that we have in our country today. As was mentioned earlier, suicide is the 12th leading cause of death in the United States. There was almost 46,000 Americans died by suicide, and far more attempts at 1.2 million. In a recent survey, about 93% of the people interviewed believe that prevention of suicides can be prevented. So it's a critically important disease, different than other diseases that have no prevention. We do have the ability to change this, which is why we are coming to you tonight to talk more about this important topic. Tonight, we're going to look at a few different things, certainly gain an understanding of what those warning signs are and what ask the question. What is Avera doing about this? What's Ask the Question all about? How you can refer other people to treatment. And then certainly going to give you some personal tips on how to identify prevention interventions. So again, looking at a few statistics, if you look at across the country, 1 in 5 adults experience a mental illness each year, and 1 in 6 youth between the ages of 6 and 17 experience a mental health issue every single year. Why that's important? Because if we don't treat those mental illnesses, they can certainly worsen. The health issues continue to get worse. You may see drug and alcohol abuse. And as you look at what we talked about previously, that there were every 12 minutes in America, there is someone who dies by completing suicide. And there's 25 attempts for every one of those people who dies by suicide. So almost 7 times as many people died by suicide in 2019 as died in alcohol-related motor vehicle accidents. So certainly it is an epidemic that we need to get control of here in our country. What would we look at as far as prevention is encouraging teens to spend time with friends and family. It's the old adage of who you hang with is who you are has never been more true than it is today. It's critically important to surround yourself or have your kids surround themselves with positive influence. Watching social media. So social media is certainly something that is a difficult thing to monitor, but if your child is not on social media yet, I would encourage you not to start now. And if once they start, when they're young, make sure you have their accounts and passwords so that you can monitor that activity. It can definitely be a place that creates bullying and a lot of other difficult situations for kids. So you can help monitor that and help them walk through those difficult times if you have more access to that. I'd also encourage you to limit how much time they have. I think screen time limits are a really important thing if you can get that accomplished. Maintaining a healthy lifestyle, eating well, exercising, getting regular sleep. These are the same things that you hear frequently for lots of things, but they're really, really important in helping prevent any mental health issues, and in particular, the topic of tonight. And then certainly keeping an eye on any medications that can impact moods. There are lots of different medications that impact moods, acne medications, thyroid medications, so they might not be designated at in and of themselves, but it could be something that is involved with mood. So make sure you talk with your physician if that's something you're concerned about or if your child is on medications. And certainly opening the conversation to have a conversation with your child is a really important step. Having that open dialogue allows them to come to you. We'll talk a little bit about suicide in South Dakota. So statistics that come from a 2019 Youth Risk Behavior Surveillance System survey. And I will tell you that this is just prior to the pandemic, and it's certainly exacerbated during the pandemic. So I'm sure these are very conservative numbers. Of the suicides that had happened between 2011 and 2020, 79% of those suicides were male, 21% were female. Most of the suicides that happened were by firearms, well over 50%. The second leading cause in South Dakota suicides was hanging. And now some statistics from that survey I referenced earlier. Almost 25% of South Dakota high school students considered suicide. And in that very same survey, 12.3% actually made an attempt at suicide. This is what makes early detection really important, and it makes it important for us to open that conversation with kids. Suicide in South Dakota is the second leading cause of death for those between the ages of 10 and 34. So you can see all of the numbers there, but as we really look at our young people, it's a tragedy that this is taking so many of our young people from us, and it's really something for us to be aware of and to try to get control of. And again, what makes this campaign of asking the question so important at this time. In 2021, there was a record number of suicides in South Dakota. Never before had we hit that high of a number. 198 suicides occurred in South Dakota. And so it really began our process of looking at how do we do something to try to reduce that and see if we can reverse this trend. It's been going up for probably almost 20 years. And so something very important for us to talk about now. I'm going to talk about 3 different things that can save lives. So we'll talk about the warning signs, both what you'll see and some of the behaviors that might be exhibited. We're going to talk a little bit more about unpacking that, ask the question, what does that exactly mean? And then we're going to talk a little bit about means safety counseling. So, and I'll talk more about that as we get there. We'll start with those warning signs. So here's a lot of things that I would really think are important. Loss of interest in things that used to be pleasurable may be the most important of all of them, but lots of different thoughts and feelings and things you may hear your child say that really are important. These are definitely red flags that you need to be paying attention to if they're saying they're feeling trapped or they don't have a reason to live or they're feeling like a burden. Lots of things that you may hear them say. And here we'll look at some things that you may see them do. Certainly increased use of alcohol and drugs is something that would be a red flag. If they're talking about suicide, obviously a red flag. Withdrawing from activities and relationships is a definite red flag. And sleeping too much or too little, which, you got to put it in context for who they are. It's not unusual for kids to sleep a significant amount. So, but put it in context, if it's very different for them, too much or too little, it could be an important warning sign for you to pay attention to. As we look at other behaviors, especially in teens, it's risky self-destructive actions that maybe they hadn't done before. Those mood swings that we've talked about before, and again, you got to put that in context. Certainly, all kids will go through mood swings at some point, but especially if these are happening after a life event. So maybe it's a breakup of a relationship or some other difficult thing going on in their life right now. It's really important to look for mood swings and monitor that to see if there's something that we need to dig a little bit deeper on. Also, if they're in classes, they're missing work or they're failing tests, and normally they're a very good student, that's definitely a red flag. So all of those red flags are important for us to pay attention to. Suicide risk is something that is very dynamic. So it isn't something that stays the same over a long period of time. It changes and fluctuates. In fact, very quickly it can change and fluctuate. Oftentimes the most charged suicidal moments only last for a few hours or maybe even only a few minutes. And that's why it's really important to ask the question, and it's really important to do whatever we can to reduce that risk. And we're going to talk a little bit about safety means and the importance of helping your kids be safe in those moments when they're under crisis. We're going to talk about what do we do during that intense risk so that we're able to help them get back to their baseline. So at Avera, one of the things that we've done is we partnered with the state. And we went back and looked at all of the suicides that occurred over the course of about a 10-year time. And then any of those suicides that touched Avera, we cross-referenced against Avera charts. And so we have an ability to look at any of those patients that ever touched Avera and kind of walk through all the things that happened before that suicide. And every one of those stories is a really it's a hard thing to do. It's a scary, important story that is really hard for us to look at. What was probably the most important thing that was as we looked at that and as we tried to determine what was the precipitating events, what were the big red flags? Is there anything that we could say when this happens, suicide's very likely to happen? And it turns out that's just not the case. Predicting suicide is right next to impossible. In fact, 73% of the time, when we looked at all those cases, there was no significant precipitating events. There was no real easy warning signs that you would have been able to identify prior to the suicide actually occurring. Now you can see there were a couple of things. Chronic pain was 8% of the cases. Financial loss was 5% of the cases. And this, of course, was all suicide, so certainly it included adults and kids. And then there were a few that, if you add that up, that's 86%. There's 14% more that were 2 or 3% here or there, where it was maybe a loss of a relationship, legal difficulties, a variety of things. But again, the major takeaway from all of that is that there was 73% of the time we would not have been able to predict that this person was going to commit suicide. There was no real warning sign or no real precipitating event that led up to this, which is what makes it so important. If you see someone having any kind of a struggle, to ask the question. You ask the question, are you having thoughts of suicide? It's important for us to ask it just that way, in not just, are you having thoughts of hurting yourself? Are you having a tough time? While those can be questions that can be precipitating, it's really important to get to, are you having thoughts of suicide, and name it just what it is. And so that you can help a child work through that. You're never going to place the idea of suicide in someone's mind by saying that. It's a myth that people think, if you really think about this, it's from the perspective of the child who's struggling with this. It's not something that's easy for them just to bring up. It's not something they're very likely to bring up. In fact, in South Dakota, We call it South Dakota nice. If someone asks you how you doing, probably 95% of the time you're going to get some variation of good or great or doing fine. And so it's hard for kids to bring it up, which makes it important for you to be the one that brings it up. If they're having thoughts of suicide, it opens a honest and important dialogue. If they aren't having thoughts of suicide, you asking that question is certainly not going to plant the idea that that's something they may want to do. So what do you do if they say yes? So what we talk about is really, you want to find out a little bit of information and then refer them on to professionals. So the first thing you're going to do is just have an open dialogue. What are they thinking? Have they had specific plans about that? Do they have a timeline around that? Do they have intent to hurt themselves? Sometimes people will say, I'm having thoughts of suicide, but I would never do that. And what are their protective factors? Why? Oftentimes people will say, I would never do that because of my family, or because of what it would do to my husband, or what it might do to my parents. There are a lot of different things that can be very much a protective factor. And so having a little bit of a conversation about digging into that a little bit and then referring them on to help. Calling the National Suicide Prevention line at 988 is a perfect way to do that. No matter where you are, that will go to your state. It started just July 16th across our country. 988 became essentially the equivalent of 911 for all other emergencies. 988 is for all mental health or behavioral health crisis emergencies. And so once you dial that 988 in South Dakota, that goes to our helpline here in Sioux Falls. But wherever you're at, whatever state you're in, that will go to the hotline for that state. And you'll be immediately connected to a mental health counselor, 24 hours a day, 7 days a week. In Sioux Falls, we have another option. You can certainly go to the behavioral health urgent care. We're open 24 hours a day, 7 days a week, with advanced practice providers, nurses, technicians, and assessment counselors, all there to serve the patient population that might need help in that moment of crisis. If you're not in Sioux Falls, you can certainly always go to your local emergency room as well. So there's multiple different places that you can go. The critical thing is that you don't wait and you don't leave the person alone. It's important that we take this threat seriously. Doesn't matter if it's the first time you've heard it or the 31st time you've heard it. It's important for us to take this very seriously and react. Get the patient the help that they need. Now let's talk a little bit about safety means. We talked earlier about the guns being the number one way that people commit suicide in South Dakota. In fact, if you pull a trigger to die by suicide, about 93% of the time you end up dead, and the vast majority of the rest of the time you end up with significant lifelong injuries. Compare that to an overdose, that's about 3%. Dead. Now, 3% isn't something to be excited about, but when you compare it to guns, it makes it critically important for us to do whatever we can during those moments of crisis to protect the patient from that. Obviously, it's South Dakota hunting is a very big thing in South Dakota, and as well it should be. But when there is moments of crisis, limiting access to guns can be a very important step. And we partner with patients wherever on that journey they will. So the best is always to get them out of the house if you can. Certainly, if you can lock them in somebody else's house or get them out of the home, that's the best. But if that's not something that we can agree on, getting them behind a locked cabinet that the children don't have any access to is certainly a second option. If that's not possible, getting them a trigger lock, whatever you can do to kind of break that impulse. As we talked about, the suicide moments are oftentimes either minutes or hours. And so anything you can do to kind of break the cycle of wanting to commit suicide, creating some kind of a barrier, can save a life. There are lots of other ways, and again, we talk most about guns when we talk safety means, but removing any other weapons that are easy to remove, or pesticides, locking up all medicines in a medicine cabinet, or getting them out of the reach of children can be an important component. in all of this as well. And certainly illegal drugs and alcohol, if you can keep them out of the home, that certainly makes it easier for protecting kids from suicides. As we talked about, it's very much an impulsive decision. And so removing those guns can be an important component. As we talked about, partnering wherever we can partner. Opening those conversations is a really important first step in the process. So ask the question, are you having thoughts of suicide? And what do we do if they come with the affirmative? You find out a little bit of information and then you get them to the resources. You're going to see more from ads. There'll be social media ads. You'll see billboards. You'll see news stories. A lot of things about Ask the Question right now from Avera, because this is an important topic for us to hit. As we talked about, once you know that there is some concern, calling 988 or having your child call 988 can be an important first step in that process. Another option is going to the behavioral health urgent care right here in Sioux Falls at 4400 West 69th. When you come in, they'll do an assessment. They'll find out kind of what's going on. Then they're going to plug you into whatever the right level of care is for your child. If it's getting set up with counseling, they'll help you with that. If it's getting set up with a psychiatrist who can prescribe medications, they can certainly do that. Might be getting into our partial hospital program where you are there for about 3 weeks for 20 hours a week. Kids come from 1 until 5 in the afternoon for about 3 weeks. Very intense programming, but they're obviously going home every evening. Or the highest level of care might be an inpatient stay. Typically a very short, acute inpatient stay, usually 5-6 days. And we try to get through that crisis, that time where there is a really high crisis of suicide, and get them on an outpatient path that will help them be well long term. We've also set up a website for you. So avera.org/ask the question. This gives you lots of different tools that you can connect with on Teams, some of which I talked about earlier. And this is available in both English and Spanish at the website again, avera.org/ask the question. I'm going to wrap up with just a couple of things again about the important next steps. So getting a hold of 988 is certainly one of those crisis lifelines that you can do. You can call that number. You can text that number. 24 hours a day, 7 days a week. It's free. It's confidential. It can provide emotional support to people in crisis. Or if it's as a parent, you want to call and talk to them because you have concerns about your child. They can help walk you through some of those pieces as well. They can certainly answer your questions and try to get you the help you need. Behavioral health urgent care, again, is one of the other options located right here in Sioux Falls at the Helmsley Behavioral Health Center. We are available also 24 hours a day, 7 days a week. You can reach them via phone at 1-800-691-4336. That's 1-800-691-4336. Or you can certainly come to the Behavioral Health Hospital, and we have a care team waiting to meet your needs. I think that will wrap up tonight's presentation. Our goal is always to get these done in about 30 minutes or so that we can get you back onto your evening activities. We appreciate very much this opportunity to talk about this important topic. And if you have questions, don't hesitate to reach out, as Dr. Knoll mentioned before, to the website if you've got references there, or call 988 or attend the Behavioral Health Urgent Care. Thanks much for this opportunity.
Thank you, Thomas. I have just a few questions that I wanted to kind of walk through from your presentation, just to clarify a couple of things for folks who are watching. So I'm wondering, I have a teenager and who is in his first year at Lincoln High School. And so I'm wondering, how do you differentiate these feelings that you talked about from normal teen behavior? Because teens tend to be more withdrawn. They want to spend time alone. So how do you differentiate that as a parent?
Yeah, great question. And obviously, as I talked about a little bit, it really is, you got to look what's normal for them, and is it different than what is kind of their baseline? Nobody knows that teen better than their parent. So the parent is going to be in the best position to look at that and really determine, okay, this is unusual. Oftentimes, again, particularly if it's after some kind of a life event, if there's a significant relationship breakup, or if there's other events, they're being bullied at school, or there's a variety of different events that have created some stress for that child, those are things to really pay a lot of attention to.
So teens are going to have ups and downs. They're going to have bad tests and maybe breakups and things like that. So how do we help to build resiliency in our children, or the ability to move past difficult things in their life? Do you have any tips for us on that, Thomas?
Yeah, there's lots of different things. Certainly, I think kids model, our parents model for their kids every single day. So as you, as a parent or as an adult, role model kind of some of those healthy behaviors and how you create coping skills for yourself, whether that's exercise, or if that's listening to music, or if that's being with friends, finding things that are enjoyable for you. Kids are the exact same. They're going to learn from their parents a great deal. They'll watch a whole bunch and do a lot of those same things. So if you can really get kids interested in different activities, getting them involved in school activities, no matter what it is, there's if you look at Sioux Falls schools, there's something for everybody. So getting involved in those kind of things, getting involved in church activities, whatever you can do to kind of help build those coping skills and those resiliency pieces. And then lastly, it's really about supports, both professional and personal supports. One of the most important things they can do from a personal support standpoint is a good parent. Kids are going to have times where they need to lean on their parents and lean on their friends. And just as we talked about before, the real critical component there is surround yourself with the right people. And then also professional supports. So, getting in with a counselor, if that's a step that you need to take, that can be incredibly helpful. I know there's certainly some stigma around behavioral health care. It's an unfortunate thing, but behavioral health disorders are very treatable things. If we can get kids to go to get the help that they need, it's an incredibly treatable disease.
So if you notice something is just off or unusual about your child, what are those front doors that parents can go to? You've mentioned some great resources tonight, but what are kind of those first steps if you have a child who's not being treated for any kind of behavioral health disorder before?
Yeah, the two that I mentioned earlier, I think are really the two that I would drive you to. 988 is a great resource. It is connecting you to a mental health counselor immediately. They can certainly answer questions, again, for both the parent and or the child. You can do that by a text, or you can do that by a calling. And so they can direct you and they can help you walk through that process. Okay, we're at a point where we need to get you to Avera behavioral health urgent care, or whatever that might be. If you feel like I don't want to do that, I don't want to go on the phone, I want to just go someplace, the behavioral health urgent care at 4400 West 69th is there and waiting for you 24 hours a day, 7 days a week. And we can help get you plugged into whatever the right space is for your child. And that really is, we wanted to make it very easy for you to access Avera behavioral health. It can be a complex system. Sometimes knowing the difference between a counselor and a psychologist and a psychiatrist can be very complex. So we wanted to make that very easy and give you kind of one place to go. You'll never be wrong to go to the urgent care, and then we'll plug you into whatever level of care you might need. They'll certainly have that conversation with the child and parent, and then suggest the resources that might be best.
My last question is around social media. As you mentioned earlier, it feels like an inevitable thing as a parent that your child wants to be on social media, and it's really hard to keep them off of there. And you mentioned some tips to keep them safe, but wondering how do you, what are some ways that social media impacts children mentally, like you mentioned, and how can you have a counter influence on that perhaps?
So lots of different studies. There are tons of studies, and I'd encourage you to do your own research on this. But many studies have shown the link between how much time you spend on social media and depression or your own happiness. And they are strongly correlated as such. The more you spend on social media, the likelier you are to have difficulties with mental health issues. Now, it's not to say anybody who's on social media is going to have that by any stretch, but certainly there is a link between those two things. And so limiting it is probably step number one. It's the best thing you can do. And if your child isn't on social media yet, holding on for as long as you can to not have them on. And when they first go on, I think it's really important to have your child's account and password so that you can monitor that. You can kind of see what's going on. You can help walk them through all of those pieces. I do think, as I referenced before, setting up screen time limits. You can do that on your phone. Your phone can limit this app to this amount of time or this app to that amount of time. There's a significant number of resources that you can try to do to help deal with that situation. But social media has been, particularly during the pandemic, has really escalated behavioral health difficulties. And so the more you can try to find other healthy coping skills, the better. And I'm not here to say that all social media is wrong. It can be used for good and it can be used for bad, but it has such a tendency to get you into a rabbit trail that you didn't intend on going down this rabbit trail, but you're there 90 minutes later looking at things that really don't benefit you. They don't help you. You oftentimes will see, the glorious highlight reel of people's lives, and it makes you think, why is my life not like that? When reality is, you probably do have highlights in your life as well. You're just not seeing all the low points on social media. So really critically important to try to monitor that as much as you can and limit it where possible.
Thank you, Thomas. Very important information tonight. We want to thank the Sioux Falls School District for having this topic and this conversation. We will have this session available on the Sioux Falls School District's website. It'll be under the counseling link if you want to access any of this information later. Next month, we're talking about anxiety. And anxiety has been on the rise in teens and children since the COVID-19 pandemic. So our next session will focus on how to identify and cope with anxiety, and it'll be offered October 18th at 6 o'clock. You can log in under that information on the counseling services area. And I want to thank you all for joining us tonight for this presentation, and we hope you have a great rest of your night.